Alright, so I'm going to be doing the assessment today for my health assessment class. I've got my stethoscope and my flashlight. Got the appropriate equipment. I'm going to knock before I come in the room. I'm introducing myself to my client. My name is Andrew. I'm going to be a nurse today.
Okay.
And your name is?
Elena
Elkins?
Mm-hmm. Correct.
Yep. And could you give me your name, or your date of birth, and
4/10/01.
your full name?
Elena Beth Elkins.
Okay. And then I would take this time while I'm introducing myself to wash, put some hand sanitizer on or wash my hands. I would provide privacy for her, so if you want, would you want me to draw a curtain or anything?
Yes, please.
Okay, so I would draw the curtain. Alright, and then we can get straight into the assessment once I ask. Is it okay if I touch you today?
Yeah.
Okay.
Do what you gotta do.
Yeah, I'm going to put on my gloves. I don't have any gloves here, but I would get them. I'm going to start from the head. I'm going to assess her hair, make sure it's clean, healthy, nothing going on, no alopecia, no anything like uneven, like patterning or anything. I'm going to assess her face for symmetry, make sure everything looks right. No edema, make sure I feel it for color, everything. And it's warm to the touch. Integrity's good, everything was good on her face. We can move straight to the eyes then. So, do you wear glasses usually?
No.
No. Okay. So she doesn't need glasses usually, and if she did not know she needed glasses, I would use a Snellen chart. I'm gonna take this time to assess your eyes. Okay. And her eyebrows, eyelashes look good. Her conjunctiva wasn't white or anything. Everything was red and nice looking in there. Can you raise your eyebrows?
Yeah.
Nice. And corneal reflex was perfect. Yeah, I mean, can you follow my follow my finger? And yeah, pretty much good. No edema, nothing on your eyes. Everything was looking good. For your ears, I'm gonna I would palpate the outer or external ear, and then I'm gonna pretend this is an otoscope, and I would take it, look, see if there's anything going on in there, such as so I could see her inner ear canal and stuff. Next I would move on to her nose, see if it's all good. Nothing, no pain, nothing.
Mm-mm.
Yeah. Your nostrils all good, nothing clogging you up. Alright. I'm gonna move on to the mouth next. So, will you open it for me? Put out your tongue. Ah. Yep. Teeth all intact. Let me see your bottom teeth. Yep. Yep. Everything looks good. Nothing going on. No thrush or anything. Teeth are looking nice. Next we'll move on to the neck to do the pulse, but not both carotid at the same time, just one at a time. So I'm gonna use 2 fingers. Pulse is normal. I'm gonna move on to the next one. Strong pulse, pretty nice. equal. uh, gonna check out your lymph system. Pretty good. Alright. Let me see if your trachea is in line. Will you look up for me? No trachea deviation. Next we'll move on to the chest. So, will you sit straight? Chest looks good, no barrel chest, nothing looking bad. Use the, well, I should start with the touching first. So, is there any like tenderness, weakness, or anything?
No.
No tenderness, no weakness? No?
No.
Okay. Can you breathe in deep, breathe out deep? Next I'll use the stethoscope to listen to her lungs. Big breaths when I put it on. Keep on your side. Do this side. Let me do the back. One more. Okay. So lung sounds were clear, no crackling or anything, no wheezing, nothing. And you have any cough or anything?
No.
Didn't seem like it. Alright. Well, we're gonna move on to cardiovascular system. I would start by inspecting her interior chest, but I'm not gonna, just because I'm gonna maintain PG status for this. Palpation I'm also gonna wait on. I know how to, but I don't want to do this to her. And she's fine with it, I know, but this is also going on YouTube, so I want it to be I appreciate you knowing that I can't do that on YouTube. Let's see. Alright, let's move on to apical pulse. Alright. Normal pulse, like about 70, close to 80 per minute. The rate was normal. Got a little faster when I started, but after that it was fine. Rhythm was perfect. Bump, 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 bump. Yeah, so that was good. And then we'll do cap refill next. Yeah, I see your finger. Well, I'm gonna do it a little higher because she has painted nails. Took about 2 seconds for that to work, so it was all good. Radio pulses, we can do those. So I'll just feel those. Well, not with the thumb. Yep, I do feel a pulse, and it is equal bilaterally. Strong, equal. Next we'll move on to range of motion. Can you flex your elbow? Both. Okay. Extend your elbow. Okay. Lift your arms up. Okay. That's abduction. So, come straight. Take it down. Alright. Next we're going to move on to the gastrointestinal. So, do you have any eating, how's your eating habits at home? Are they good? Are you a little hungry?
I eat a lot.
You eat a lot?
Yeah.
How many calories a day would you say you eat?
Honestly, I don't count. Normally I eat 3 meals, but then I snack throughout the day as well.
Are you exercising regularly?
No.
Are you watching what you eat?
I try to make sure the things I eat aren't that bad for me, but I definitely have a big appetite.
Okay. Big appetite. That's good. Not bad, but just make sure you're watching when you eat all the time. I'm not trying to give you any, just if you're doing anything. You have any big changes in weight recently?
Been the same weight forever.
Okay. And I would obviously do an objective as well to see if there's been any big weight changes or anything. Any constipation, diarrhea, any flatulence, incontinence?
No.
No? So I'm going to lay you down and check out your tummy. So first, I'm going to just look at it, see if it's all good. And it's looking pretty good. No distension, nothing. Next, I'm going to auscultate. Make sure I hear all the bowel sounds. Hear all the clicks in all the areas, so that's good. You can sit back up if you need. Actually, no, I need to palpate. My bad. So, as I'm palpating, I'm making sure I'm looking for any areas that are tender, pain, so if you have any pain, just let me know. Yeah. Anything like distension or areas that may be hurting or something, or abnormal. Noting for temperature and everything along those lines. So you're good on that. You have any urinating problems? No? Okay. So I'm going to have you get up so I can just look at your walk to see if you can walk normal or not. No unusual gait. And then I would check her muscles, see if there's good size to them, tone and all that. Any tremors or anything, it's just, no, but she doesn't have any tremors. More range of motion stuff. So we're gonna, like, can you rotate your neck? Yep. Can you, like, rotate your shoulder? Both of them? Yeah, okay. Can you do this? Can you do this? Okay. Can you push on my hands? Okay. Pull on. Ooh, strong. Alright. And then this. Okay. Lower extremities. We're gonna look for edema, so you can sit back down. So we're gonna look at her feet, make sure like there's nothing abnormal, like any lesions or anything. Nothing going on. Assess the cat refill. It is a little cold in here, so it's closer to 2 seconds. Or closer to 3 more than anything. But it's fine. Temperature's a little cold, but she's not wearing any socks, and it's, cold in here. Otherwise, the temperature around around the rest of the body is fine. Make sure I find the pulses, pedal pulses, which are.
Do you need my feet up?
I mean, I would mind.
Good.
Okay, so yeah. So I'm gonna look for the pedal pulses. I got these right here. And just check to see if I can find the pulse right here. Yeah, doing pretty good. Alright. So we'll do hip flexion. Alright. So can you raise your knee up, like, on both sides? You put them out? No, like out. Like that, back down,
Oh.
basically. Could you do this and this? Yeah, you don't have to sit down for that if you don't want
Yeah.
to. But
Yeah, I just need to go sit up.
yeah. And then, what about your knees? Can you put them out? Both of them? I mean, you don't have to do both of them at once, just and then bring it back. Okay. And then you're gonna push your feet against my hands, and then pull against them. I guess would be the looking for flexion or dorsiflexion and plantar flexion. Already did the pedal pulses, so as long as you're comfortable, the assessment will be over. Is there anything you want to tell me?
No.
Nothing else going on at all?
No.
Okay. So I'm going to gather all my supplies, make sure I cleaned up. Everything's safe. I put the bed back down because I usually have her a little higher up, but this is just a weight bench to simulate. Yeah, perform my hand hygiene. And get out of here.